Good afternoon. Welcome back to the IJIS mid-year briefing. My name is Maria Cardiellos, and I am the Executive Director. If you had the opportunity to participate in our first webinar this morning, I trust that you have come to understand the value of our panelists. We are confident that we will continue that momentum with our second panel entitled Leveraging Technologies for the Public Sector. Our panelists include Denise Kitts, Chief Data Technology Officer for the U.S. Department of Veterans Affairs, Michelle Gregory, Countywide Data Analytics Coordinator for Fairfax County Department of Management and Budget, Benji Hutchinson, Vice President of Federal Operations for NEC Corporation, and our own IJIS Board of Directors Chair, and certainly last but not least, our former Executive Director, Ashwini Jarral, who is now the founder and COO of Idea4. He will also serve as this panel's moderator. Given some of the challenges that you already heard about in our earlier panel, this group seeks to go one step further to address how certain technologies could actually facilitate those mission objectives, whether from the public sector side, understanding the technology, or from the private sector side, supporting the mission goals. Each of these panelists provide a unique balance and perspective that will enable remote operations, improved preparedness, and maintain effective operations. With that, I toss it over to our moderator, Ashwini. Ashwini, it's all yours.
Thanks, Maria. Good afternoon, everyone. I hope everybody's doing well. Your families are safe, and we're glad that we are meeting each other in this way, but I'm glad that we're having this webinar and IJIS Institute mid-year briefing. So for this panel, one of the things that we thought was it'll be good given the current circumstances and some of the lessons learned from the pandemic, and we're still learning on a daily basis, is how technology can be leveraged to help solve some of the challenges in the public sector to address not just the COVID-19, but also how we can prepare ourselves in the public sector with partnership with private industry to help overcome some of the challenges that we face on day-to-day basis. So as Maria said that we have a esteemed group of panelists here. So before we get into the conversation, I will ask each of the panelists to take a minute or so to talk about their background and introduce themselves. So first, I will start with Denise Kitts from Veteran Affairs. Denise. Denise, you're mute.
Can you hear me?
Yes.
Okay, great. Hey, good afternoon. This is Denise Kitts with Department of Veterans Affairs. And I'm in the role of the Chief Data Technology Officer in the CTO's office within, under the CIO. And my role is to help the department treat data as a strategic asset and meeting our mission. In terms of my background, I'm new to this role. It's a brand new role for the department, along with the Chief Data Officer. So really excited about that. But I spent the last 5 years in the Veterans Experience Office, doing human-centered design, qualitative and quantitative research, and understanding what our veterans' needs are, and then driving some modernization initiatives to include digital and enterprise data management. So happy to be here.
Thanks, Denise. Also, Denise, for some reason, your video is gone, so we cannot see you. So if you can just turn on the camera. Okay. So next, Michelle Gregory from Fairfax County.
Good afternoon. My name is Michelle Gregory. I think my background, current position is very similar to what Denise shared. I work for Fairfax County government in a new role entitled Countywide Data Analytics Coordinator. It's a role within the Department of Management and Budget, but it serves the county overall, and that's under the CFO's office. Our goal in this particular new role that was created was to make sure that we're definitely using data as a strategic asset, but we're really focusing on how we harness the vast amount of available data in the county. We have a large number of agencies, but using that data effectively and interpreting it to bring greater understanding for some of our challenges is what we're striving to take the next step forward in. Some of this is done individually, but connecting the dots across multiple organizations is what we're striving to do.
Thanks, Michelle. Next, Benji Hutchinson from NEC.
Hi, everybody. Good to be here with you today. I run the federal business for NEC Corporation of America. Obviously, many of you may know NEC. It's a very large firm, multinational firm, headquartered in Tokyo, but the American subsidiary is headquartered out of Texas. And so we have a team that operates here in the Washington, D.C. metro area. And my background, I've been in the technology sector for about 25 years in various roles. But with the federal government, I've been working primarily in biometric technologies, but also in artificial intelligence and computer vision related technologies. And that's probably what you're going to hear me talk a lot about today. We've seen how those technologies have had a transformative effect on various types of mission sets across the federal government and the public sector and law enforcement and also in the private sector. But, the mission sets that we support today are wide ranging from the Department of Defense, whether it's counterterrorism or Department of Homeland Security, border security or Secret Service, law enforcement or Department of State, immigration, transnational criminal activity. And so what we work to do is help to identify individuals and also introduce new technologies that can enable more frictionless, contactless, touchless experiences for a lot of these customers and use cases. And I think that's going to be a big part of what we talk about today, especially in the COVID-19 era. So glad to be here and looking forward to the discussion.
Thanks, Benji. So as in the introduction, you heard about technology innovation, but what Denise and Michelle brought up was the data as an asset, because one of the big lessons learned in this pandemic is that not only how we bring new technology, but also as we are bringing more data through the technology and making that accessible to our remote workforce and our clients that we serve, is how we can also protect them. And we'll touch on those topics. So before we get started in the discussion, a panelist discussion, I just want to remind everyone, you should see a panel on the right-hand side to post your questions. So we want to make this interactive. So we will have a few minutes at the end of the discussion to answer some of the questions. So we'll encourage everyone to type their questions in the panel, and we'll discuss those after the panel discussion is done. So the first question that I have for the panelists are, what are some of the lessons learned from the COVID-19 pandemic where technology could have been used to more effectively address the response and to better meet the requirements of the operational needs of the agency? So Denise, why don't we start with you first?
Sure, thank you. So I think everybody's familiar with the VA. Our mission is to serve, veterans, caregivers, survivors, and their families. And the work of the CTO office is instrumental in making that happen. I think what we learned was that I think COVID taught us that we need to be thinking more about interacting with our customers however they want to interact with us. Whatever modality and channel. I mean, obviously with COVID, that limited the number of in-person interactions that we could have. And if you think about the VA and delivering healthcare, we had some major challenges around that in terms of being able to still support, over 140 million appointments that we typically have every year. So we had a really, really, really big push in the telehealth arena, where we had to move from in-person appointments to telehealth. And we had OINT had. Fortunately, OINT had already begun some major modernization in the digital space. We'd already started modernizing our cloud infrastructure, modernizing the way we were delivering applications through agile development methodologies. And so when COVID hit, it was really a matter of kind of leveraging the investments that we'd already started making, in the digital space, the cloud infrastructure, telehealth infrastructure. And the things that what we learned first and foremost from our customers was getting authoritative information out to them. And everybody, when COVID hit, it was all about really having trusted sources of information. And we had we've spent the last 4 or 5 years modernizing our digital space, and we have a single front door for our customers to go to get authoritative information, va.gov. So when COVID hit, it was really about getting authoritative information out under va.gov. So that was like the immediate thing. The second thing was how do we improve upon it? So we've got authoritative information out there, but how do we improve upon the experience that veterans are having or caregivers are having when they go to va.gov? So COVID presented the opportunity for us to deploy our first chatbot. So in a matter of about 2 weeks, again, kind of leveraging a lot of infrastructure we'd already put in place, we deployed our first health chatbot. Infrastructure, security, content, everything, huge success, and we're continuing to iterate on that. And then in running in parallel, we talked a little bit about data. It became instrumental, to the undersecretary who runs health to really understand what was happening in the hospitals, both from a supply chain standpoint. Do we have PPE? Do we have enough PPE? Where are our respirators? What bed management? So when you have an operation the size of VA with over 170 medical centers, being able to have near real-time data in the hands of leadership to understand where to put resources, how to move equipment around, became really the urgent thing that we had to deal with. And so we again kind of leveraging infrastructure, cloud infrastructure, modern data analytics. We were able to pull all that data together and present real-time dashboards to our leadership to be able to make take action and make decisions on a daily basis around moving resources, moving PPE, moving respirators. So, I guess I would say the lesson learned is that don't wait for a pandemic, and invest now, right? The reason we were able to pivot so quickly and deliver on things that were really needed was because we had already made investments in so many critical places around our infrastructure, digital modernization, and cloud.
Thanks, Denise. Michelle?
Yes, I think that was great what Denise shared. I think at the local level for Fairfax County, we deal so much with so many different agencies that we quickly found out how important it was to give people flexibility in where and how they could respond based on their business. So we have everything from social workers who are trying to figure out how do I continue to deliver services where sometimes I might need to, or typically I might be meeting with that person face to face, police and fire and rescue, as well as then some administrative functions. So for the administrative functions, it was about deploying the technology and the hardware and the software that allowed us to work remotely. And while a lot of that was already in place, it definitely brought on the pandemic to give us the ability to push some of that agenda forward in a way that was out of alignment with what the current trend line was in terms of how quickly we would have deployed some of those resources prior to the pandemic. So I think it allowed us to understand what we were really capable of and to continue to deliver services in an appropriate and effective way, even through those adjustments. So lesson learned, I think I definitely would want to echo what Denise said in terms of don't wait for a pandemic. My area of work in terms of data analytics, I've been working for Fairfax County for over 18 years. And while in this new role, still have been doing data analytics in various ways. I think while definitely data had already been an increased value for the county and continues to be such, there definitely was a greater importance and now even greater importance put on how accurate the data is, how quickly we can make it available, how accessible it can be to the various staff across the system, because different stakeholders use it for different questions that they're trying to resolve. And I focused on interpretation when I did the introduction, and that really is key. We have a lot of data in the county. But in terms of how we really interpret it and how we connect data sets for greater insight is where we still have some room to grow. And I'm sure we will for the foreseeable future. But that's where I think lessons learned in terms of how do we have a platform that allows us to do that quickly and effectively in terms of that analysis piece. And how do we then share it in a way that's easily accessible and digestible for stakeholders.
Thanks, Michelle. Benji?
Yeah, so you're going to hear some echoing of themes, right? So don't wait for a pandemic, don't wait for a crisis, but unfortunately, don't waste the crisis once it arrives. I think so often in the public sector, we all struggle so hard to make things happen as quick as they can, but there's challenges, there's requirements and policies and laws and frameworks we have to follow for many good reasons. But we get stuck in some of those for longer periods of time than we had wanted to often. And, for a lot of the mission sets that we touch, that's been the case. And, there's other reasons why, but a lot of the artificial intelligence or computer vision technologies that include biometrics or screening people have been around for a long time, right? Since after 9/11 for counterterrorism operations or whatnot. But, for moving people through spaces, which is what we do a lot of for Department of Homeland Security, whether that's Customs and Border Protection or for our aviation customers, we support Delta and Lufthansa and the Star Alliance, who work closely with border officials like CBP and TSA. They've looked for ways to efficiently deploy technologies like facial recognition to screen travelers as they move across borders. And there's been some challenges. Initially there was challenges around the real estate within the airports, and then also there were the policies around the data and privacy. And what's interesting for me is we're seeing all of this happen in real time of how we respond to the pandemic and prepare for future pandemics. Because after the initial sort of gut punch of March, when the airlines took that huge hit and everybody has been trying to recover from that, and they still have not completely. Initially there was a fear factor, but slowly DHS officials and the aviation officials started to take a step back and say, what can we do to accelerate the adoption of this technology? How can we get it out in the field to prepare for people coming back, to get travel, trade, and those things moving again? And we're still working through some of that. But I think there's a greater acceptance in a lot of corners of what we see to roll out that technology. And a requirement that we didn't foresee before the pandemic was elevated body temperature screening, right? So to get people, and it does not detect COVID-19, it does not definitively detect a fever necessarily, but it's a risk factor. And it's something that can get people back in the skies or get people moving. But we've gotten interest from a lot of different places across the public sector. DoD has stepped up and they've expressed an interest in replacing some of the technology they've used for physical access. So, they have a really important mission to make sure that troops remain at high levels of readiness, and so people aren't sick. So we all remember from the headlines, the Roosevelt, the Navy ship that had a bunch of folks that were contaminated, that were sick. They don't want that to happen again. So there's been a lot of emphasis on, okay, what do we do? How do we deploy some of this technology to screen for people who might pose a risk or might have the illness or a future illness? And so I think there's a real willingness to look at some of these cutting edge technologies that we've known about, but maybe have been reluctant or thought it would be too hard to deploy. I think a lot of that resistance is starting to dissipate, and people are more excited. And this is what we've seen historically, right? Anytime there's a major catastrophe, one of the things you often see is that technology is embraced, and the old ways give way to the new ways and new methods, and people are more comfortable with it. So I think looking forward, we're going to see people adopting technology at a more accelerated rate. That's what we're seeing.
Thanks, Benji. And I know, Benji, you already touched on our second point that we want to discuss is that how the existing policies, processes, or even staff training impacted the continuity of operations in implementing some of the new technology. Because one of the things that we learned was that just listening to Michelle, Denise, and Benji, you all talked about is that I'm going to use the term going to the market, but bringing the technology to the staff. But is staff ready? Do we have policies in place that actually embrace the innovation? So the question is that how the existing policies, processes, and staff training impacted the rollout of this new technology. So Michelle, why don't we start with you?
Well, the first thing I'm going to comment on doesn't directly deal with technology, but definitely deals with how we supported continuity of operations as it relates to technology. And it really kind of was about leadership at all levels of the organization, and how there was specific action to communicate effectively, regularly, and often about what was happening. You know, things were changing so quickly that in order to establish a policy across the county that quickly, maybe it didn't happen at the same rate, but the communication was essential. And then it was followed by some procedures and some policies in many cases that supported what we were striving to achieve. So I think that was really critical, as well as giving some autonomy to different agencies to think about how their specific business needed to function under these circumstances, and what was the technology, the infrastructure, the resources they needed to continue operations. So that was critical. I think it worked really well, at least for Fairfax County government, in being able to manage both of those things. And so it required, again, just reiterating kind of the leadership from the board level all the way down to other staff within the organization to be able to make sure that everything flowed, and staff, as well as then the residents, were able to remain receiving services throughout this process. That was critical. In a more specific way, I really want to shift and talk about our reliance on some location data that does have a direct technology impact. The county overall, as well as individual agencies, has continued to be more dependent on GIS and location-based data. It's even more important, I think, now as we know that there have been various efforts nationally and globally in terms of how do you pinpoint where outbreaks are happening, what resources are needed where, and for whom. And so having that information available has been critical. And what I think where we could grow and enhance ourselves as well is thinking about what is that whole process in the flow of data that gets us to a place where we can use it effectively in GIS. And so what I would say in terms of training and policies that could support that would be, how do we then prepare staff who see the value in some of these tools, but as we're inputting data, how can we improve data quality such that we minimize some of the work involved in data cleaning, that allows us to process it more effectively, more efficiently, and use it faster, and feel like it's reliable information that we can depend on. Something as simple as, consistency in how we look at addresses would be critical in how we can support ourselves in moving through this pandemic, the planning activities that support, county activities, as well as then thinking about future planning and how we prepare for upcoming work in terms of development, in terms of making sure resources are available, and to think about which parts of the community have been hardest hit and how. So a lot of the data that we use goes into those types of efforts. And so that's where I think, in terms of the question around training or policy or protocols, I wanted to use that as a specific example to say how we can really support ourselves long-term, and the types of technology that I think will make us more efficient and effective in meeting our needs.
Thanks, Michelle. So I just want to expand on the location data, because that's one thing that we're observing is location data is becoming very critical. So from your perspective, is it about the data itself, or is it connecting to the right technology that can help us get the data real time so the resources can be allocated? And you use the term location, where we know where the pandemic is growing or where the hotspots are. So is it more about the data, or is it more about connecting to the technology that can help advance in the collection of the data for better decision making?
I think it's both. It's both because the technology can help expedite and the whole analytical aspect of it. So different technologies, and we were just having a recent conversation around that, can give you a better advantage of being able to display and or being able to analyze some of that location data. So technology plays a role in it. But then the data itself is also critical, because what are you analyzing if you don't have quality data to begin the process? So really they go hand in hand. And as we're looking at our planning efforts, we're definitely tying those two aspects of it together very closely. How do we look at the data? How do we look at managing the data effectively? And how do we look at then the technology that supports how we can analyze it more efficiently and then display it and share it more effectively?
Thanks, Michelle. Denise?
Yeah, I think just to pull the thread on something Michelle said about the data and the technology to your question, VA we have a ton of data, as you can imagine, and we made a lot of use of it in terms of the location data. It was really, really important for us to understand hotspots with COVID. As I mentioned earlier, we have over 170 medical centers. Not all of them were experiencing the same level of the pandemic at the same time. And so we used a lot of data and analytics to find those hotspots. Originally, Washington State, then New Orleans. And that data, not only could we could also commingle it with other sources and start predicting where we thought the next hotspot was going to be. And that enabled us to make decisions around, moving resources, moving doctors, moving nurses, moving PPE, respirators. So yeah, I love what Michelle was saying. I just kind of wanted to foot stomp that a little bit. But kind of getting to the question about existing policies and processes and staff training for continuity of operations. And so as you can imagine, VA has 400,000 employees, 170 medical centers. We're massive. We spend a lot of time thinking about continuity of operations, especially in the health side of VA. And we've always done amazing things with continuity of operations. We've dealt with hurricanes, with medical centers shutting down, moving patients, but this was different. COVID was very, very different. It wasn't like, a hurricane where, you rush into a particular area. It was spread throughout the country. And, so that presented like different challenges. And I think from a policy perspective, one of the things that, VA was fortunate to have in place was, unlike the private sector, telehealth. So, and the fact that a doctor anywhere in the country could treat a patient anywhere in the country. And I don't know if everybody understands the limitations that the private sector had around telehealth when COVID first started, but telehealth was very limited. You're only licensed typically for your jurisdiction. A lot of limitations, with payers and that sort of thing. And VA was not only positioned from a technology standpoint with a robust telehealth platform, but we had the policies in place that would enable providers to see veterans across the country from anywhere. We had the training in place. So we had all the components, and we went from on average to about 200 telehealth appointments on day to over 2,000 telehealth appointments per day. So it's just, and I think that's because the policies were there, the processes were there, the technology was there, the staff training was there. But to give you another example of where, we weren't as fortunate with continuity of operations were around our contact centers. VA has over, depending on how you define a contact center, we may have over, 300 different contact centers that veterans can call for everything from women's health, combat vets, mental health, all types of different contact centers. Some of those were prepared in terms of from a process policy training standpoint to go completely remote, which none of us ever predicted. Most of our contact centers are premise-based, staff, sitting in seats, answering veterans calls, caregiver calls, family members. And so when COVID hit, we tried to stay in that framework, but then the moment we had like the first agent that got exposed, we had to go overnight to a virtual operation. And so that meant, training, laptops, policies, how do you ensure that people are sitting at home accessing veterans' data are doing it in a secured fashion? So we quickly had to leverage a lot of lessons, best practices from some of the contact centers that had figured that out so we could scale it across the entire operations. And so that was just an example of, one example of where everything was in place, where we were really easy to scale out on telehealth, which was a huge success story and will probably, continue to be a big part of how we deliver care. And then, lessons learned around not really having the foresight to kind of think about policy process and training around being able to take contact centers completely virtual, within 8 hours. So.
Thanks, Benji.
So what we saw was obviously a massive impact to travel, tourism, and trade, and immigration as well. So when we talk about training and adjusting for continuity of operations, we saw an amazing response, because the government often gets beat up for being too slow to respond to things. I have to give them credit, because there were very large agencies that participated in a working group that was intergovernmental, and one of the major artifacts that were produced out of that was a document that was called Runway to Recovery, and that was published by Department of Homeland Security, Department of Transportation, and Health and Human Services. So they came together to sort of put together, okay, what is the framework that we need to use or implement or suggest that people deploy to get everybody moving again safely, right? We can't just go back to the way it was. And the impact was enormous. I mean, it was unprecedented. People, I'm sure everybody has heard of these stats, but they're worth mentioning again. After 9/11, the days and weeks after 9/11, we shut down air travel completely for, I think, only a day or two. Well, we saw drops in travel at the 90 and 95% levels. We saw gates across the country where we were helping airlines and CBP process travelers and people coming in and leaving the country. There were tens of thousands of people moving through ports, and that dwindled to hundreds. So we're talking about massive impact. When you see all the economic data and you want to figure out how it got that way, these are some of the stats that make sense. So the government came together, and I think a lot of the stakeholders from the aviation and travel and tourism industry came together and said, we've got to figure out a way to get this moving again. What should we do? And it's the things that you're seeing on the news or you're seeing in the airports if you're traveling again, which is people wearing masks. There's tape and directions on the floor keeping people safely distanced. There's plexiglass up where the gate agent used to be able to freely interact. I mean, if you think about using facial recognition to vet somebody when they check in or go through the airport environment, if they don't do that, then you're handing over a ticket or a paper document that somebody's touched, and you're also handing over an official document, whether that's a passport or a driver's license or a government issued ID, to maybe 5 different people. And they do that, especially, and it's not only a danger for the travelers, but it's also a danger for the workers in that environment. And some of those people are deemed essential. So they've got to work, whether you're a ticket agent with the aviation sector or you're a TSA agent at the document checking center, the TDCs, or you're a CBP officer. There's a lot of interactions with the public. And so taking those safeguards, the plexiglass and everything, we weren't thinking about that beforehand. We weren't, and we had to adjust. We had to be nimble, and the government had to do that, is to implement those changes. And then, also, what's the impact to something like facial recognition when you put a mask on? I mean, facial recognition is predicated on being able to see a face. So we've all had to adjust from that perspective. But, again, I think that we're doing all we can to figure out how to get back on track. It's going to be a long road. We're still in the middle of it, but there's definitely been an impact to training. And then the last thing I'll mention is everybody's been talking about the data piece. One of the things we never talked about before was health-related data. Now, all of a sudden, we're talking about elevated body temperature data, right? How do we safely take someone's temperature and delete that data immediately, make a decision on the point, at that point in time, and safeguard it so that it doesn't get out or have any sort of negative consequences on an individual. And then from a training perspective, is what do you do with a traveler if they're sick or if they have a fever? There's no hospital necessarily inside of an airport. What do you do? Do you turn them away? So all of those questions have been hotly debated over the past several months, and I think we're still going to see some vigorous debate around it. But at least now we have some framework, we have some things to think about and some places to sort of push everybody and get things moving again, but it's still pretty dynamic.
Thanks, Benji. And I can see a few questions coming in, and we'll just touch on them in a few minutes here. So the next question I have for the panelists is, because I know we talked about security and privacy. So what were some of the security and privacy concerns that agencies or even from the private sector supporting these agencies that were faced that became a roadblock or a hurdle in implementing new technologies. And one such example, we all know that we all were so used to Zoom. We're using Zoom, and then this whole security vulnerability was exposed, and we all were rushing around to say, we cannot use Zoom, we have to go somewhere else. And everybody was jumping on that bandwagon. So what were the lessons learned from your perspective in implementing these technologies, where you have to be mindful on how to ensure security and privacy as you roll out this? So, and Denise, why don't we start with you?
Sure, thank you. Yeah, I mean, technology can do so much for you, right? So I guess I would, in terms of what we're trying to do in VA is obviously promote innovation as much as possible, but do it in a secure, in a secure manner. And so we're kind of grounding. It's all about data, right? So when we think about security and privacy, it's all about data. And so the federal data strategy, which came out, I think that was like July last summer, it was really about charging the departments to leverage data to the full value to support mission, service, and public good. And so I think our challenge inside VA is how do we be innovative? How do we use data to meet the mission, but at the same time do it in a way that's secure and protects privacy? And so it's really all about balance. And it's really, really important that we get it right, because it's we need to be good stewards to our customers' data in order to make sure that our customers still trust us, because it's all about trust in the public sector. And so we've, within OINT, and then partnered with the Chief Data Officer, Kshemendra at VA, we've put a lot of time and resource and thought into establishing a data governance council. And underneath the data governance council, we've declared data stewards. And so a data steward is somebody that basically has the responsibility over a domain of data. It could be health data, it could be benefit data, it could be clinical data, it could be what we call customer data, name, demographics, things like that. And it's that data steward who really is the champion for making sure that the right things happen with that information. So, because again, we want to be innovative, we want to share information with with our partners in the private sector. We want to do as much as we can to benefit our customers, and allowing innovation to happen, not just in VA, but in the private sector. But so we really do rely on those data stewards to make sure we're doing things in a manner that is secure, meets the privacy directives of the government, but at the same time push it as far as we can, where we still have that balance and we allow for the innovation. So I think the technology can kind of run as fast as it wants to run, but there's always a checkpoint, in terms of at some point the technology needs data. And, that's where they got to come back to the data steward, and the data steward's like, do you have a right to know? What are you doing with the data? They ask all the right questions, and we make sure that we're really doing the right thing with the data and, and serving the mission and meeting our customers' needs.
So Denise, along those lines, I know that you use telehealth as an example of innovation where Veteran Affairs was already ahead of where telehealth industry was. Did you have some of the lessons learned on how you actually package security and privacy as you were rolling out the telehealth platform for the veterans?
Yeah, and I think it's multi-layered, right? There's the platform, right? The infrastructure that has to go through a lots of rigor around what we call authority to operate. And there's all kinds of controls to make sure that, the security boundaries are there and that the infrastructure is safe. And then I think then it goes back to data, right? So, from a telehealth perspective, we want to make sure that clinicians have the data they needed at that, but then also that the equipment that was being used in the home was, secured in a fashion that we were authenticating the user. We knew exactly who we were dealing with on the other end. So we wanted to, we implemented modern authentication, from an access perspective to make sure we really knew who we were talking to on the other end before we exposed data. So it was a combination of lessons learned, like secure the platform, secure the data, and then identity and access management. At least from a telehealth perspective, played a really, really big role. You want to make sure you got the right person within both ends of the pipe. As you're collecting data and clinical interaction.
Thanks, Denise. Michelle.
Take myself off mute there. I really echo everything that Denise said about, trying to make sure that there's a balance especially with so many different business areas, and trying to make sure that as they creatively try to support their clients, that they're also doing it in a way that's secure, and that we can continue to maintain that trust. One of the things, though, that we're working on actually in IJIS is supporting this project is an enterprise memorandum of understanding that's going to help us build a platform for data sharing. This initial platform won't address every question. We'll still need to look at other data sharing agreements that could be attached to it, but we're right now in the process of developing this enterprise MOU that will allow us to begin to identify some of those foundational principles that we want in place when we're talking about data sharing, and also addressing some of those privacy concerns. We're looking at it within a small area right now, to be able to be really thorough about the practices and protocols and legal aspects of the EMU. But we're doing that in order to also be able to replicate it across other business areas. So right now, this particular project deals with opioids. With that being the case, and obviously dealing with health-related information, we know that we'll have to tackle some of those challenges that are inherent to dealing with health-related information and privacy. But with that, if we are able to overcome some of those initial hurdles, we think that it will be a great building block for other topics and other areas of concern in terms of how we use data. As that relates directly to technology, there's also a part of this project that's about how we don't get stuck in the ideology of thinking that we have to have like a data warehouse that forces us to commingle data in one particular repository in order to use it effectively or share it effectively. And so that's what's really exciting about this project, is that by the end of it, we should have a pilot that gives us an ability to share information across providers. So it's not yet, we don't yet have a protocol in place for where we could deal with research and analysis and using that data in that way. But we think that it's really effective to think about the front line, right? And how do we serve residents as part of that first tier? And so this particular project will allow us to have a pilot that's sharing that data in pretty much real time, not as close to real time as possible, but to be able to allow those providers to share that information to most effectively serve a particular resident in that immediate circumstance, and not have to wait for a long period of time after that to be able to connect with the right providers and so do the planning and processing of that data that usually happens. So we feel like that'll be a great step forward for us, and we're using it as a foundation in concert with our Department of Information Technology and our county attorney's office. So we have some of the right players at the table to make sure that this is done well before we roll it out.
Thanks, Michelle. Benji?
Yeah, for us, it's a combination of doing what we've always done, fundamentals, sticking to the fundamentals, but also expanding upon those, right? So what I mean by that is, when we roll out the type of technologies that NEC typically rolls out to support CBP or TSA or any travel oriented organization, they typically are biometric technologies, or more recently elevated body temperature. So we've got to make sure we're working real closely with the operations team, the CSOs, the CIOs, and so forth, whoever touches the network or the data, to make sure that the privacy impact assessments are updated. So it's all about transparency and letting everyone know where is that data going, who's using it, who has access, how long are you going to handle it, where is it going to be transmitted, can it be hacked, is it encrypted, what are you collecting, what specific data elements, right? So that becomes really important when you introduce something new, like elevated body temperature screening, into like a facial recognition platform or any other biometric. Like if you want to collect an iris image for authentication or for border management, we don't do that so much in the US, but in other countries they do. So you've got to think through that carefully. And that's quite honestly been a lot of the discovery phase around making sure that as we look to enhance a customer experience or a customer journey, we don't break anything we've already built, right? So we were talking earlier about training and lessons learned and so forth. One of the things that I'm often fearful for is that we forget lessons we've already learned, right? Everybody's so quick to want to learn the next lesson that they forget the lessons, and I don't want to sound like a stodgy old guy, but the lessons from 9/11, right? You can't throw all that stuff out just because the new conflict is here. You have to sort of build on top of it. So, we spend a lot of time making sure that we comply with U.S. privacy laws or European GDPR related regulations. And it's a compliance factor on both sides, right? When we're from the private sector building platforms or technology, we have to make sure that we build that technology, build into that framework, right? It has to fit inside that framework. And then once we start to roll it out, we have to work with our customers or the government, private or public sector, to make sure that we roll it out accordingly, and that we check off all of the boxes on their side so that if they get audited, they're okay, and if we get audited, we're okay. It's a real partnership and a dance that has to be danced. It has to be carried out for everything to work properly. So.
Thanks, Ben. Just as you talk about the customer experience or the user experience, so then my next question for all of you is that as we're thinking about technology and what we have implemented and also what we're going to bring to support overall operations, how did you address the user experience in implementing any new technologies needed? So Benji, since you touched on that, I'll start with you.
Yeah, no, and I already started to allude to it, right? I mean, it's that intimate customer relationship of listening. I think, from a business perspective, we go back 10, 15 years, people used to always lead with, hey, listen to how cool I am, right? I'm the best new company. I got the best tech in the world. You're going to love this. It's best price, all that stuff. And I think everybody started to realize that none of that means anything unless you can really solve somebody's problem and deliver the value that they need, right? And so that does a lot. That goes a long way to just being quiet and shutting up and listening a lot and asking the right questions in this discovery phase of customer experience. I think that's one of the important lessons out of the whole CX and digital transformation or DX trend, is that we've focused more on the front end of saying, okay, what are your problems? I'm not going to tell you how cool I am. Like, what are your problems? How can I help you? How can I bring more value to you? And then let's talk about all the other pieces a little bit later down the road. And I spent some time in DOD, which is strange because we would always start with those slides up front. Here's who we are, our mission, how cool we are. And it's like turning that completely on its head. You want to start with the dialogue. Let's talk about you. So, I mean, that's the way we've approached it, and it's been successful so far. And I think moving ahead, it's even going to be more success or even more important as we try to confront common problems that nobody's really encountered before, right? We've got brand new challenges that really require everyone working together to solve. It's not just going to be like, hey, I've got something out of the box, it just works. It's got to be solved iteratively, and people have to be flexible.
Thanks, Benji. Denise?
I'm sure I'll go quick. So I drink the Kool-Aid on this in terms of, and making sure that we're, as we're applying technology, that we're actually solving the right problem and solving it the right way. A lot of times we apply technology because it's cool, it's innovative, and it doesn't always meet the mark. So, around 4 years ago at VA, we really made a substantial culture shift especially in the digital front. Everything we do is, based on human-centered design. So, we're using, if you haven't, human-centered design is basically qualitative, quantitative research. We do a lot of surveys with our customers. We've built out, Benji mentioned journey maps. We've designed the veteran's journey from the time, a veteran enters into the service, kind of cradle to grave, and the moments that matter and the pain points along that journey. And we make sure we're applying solutions to those pain points. And then as we get into building out the technology, so once we know like the problem we're trying to solve and that it's addressing a true pain point, as we're building out the technology, we continue to use, qualitative, quantitative research to make sure we're building the tool the right way. And sometimes those technologies are veteran facing, like va.gov, where we are constantly working with veterans and getting their feedback on the research and the product that we're building. Or they could be frontline employees. I mentioned earlier about contact centers. We have a lot of frontline employees that are delivering have direct interactions with our customers. So, whether we're building something that's customer facing or we're building something that's employee facing, we make heavy use of human-centered design and making sure the voice of the customer is driving whatever the product is.
Thanks, Denise. Michelle?
I wanted to just expand on that point around understanding the customer. And in this case, from a county level, I'm thinking about the residents. And in general, from an internal perspective, we do a lot in terms of collecting data for metrics and performance and that type of thing. And we definitely collect surveys and data for surveys, qualitative and quantitative. Where I think there'd really be value is trying to get a better handle on how we use and process kind of the social media data to better understand what's happening in our community, what people are thinking, and how we can couple that with some of the other data that we use for general understanding and analysis of our environment overall. That would definitely allow us to take a step forward. We have some social media outlets that we use on a regular basis, but really maximizing that and taking it the step further to say, how do we use them to communicate more effectively with our residents? In Virginia in particular, there are lots of laws that put stipulations on how you can communicate with the public to best, in public meetings and those types of things. Definitely COVID-19 has allowed us there's some flexibility in how that's done, but we can even do better, even beyond this, to think about ways to engage and regularly collect that feedback as opposed to waiting on a survey. So.
Thanks, Michelle. So I have a few questions here. So just to recap the discussion, because I'm going to start backwards, I think I like the term journey map because I know that's comes from the DoD world, but I think that is something that we have learned through this pandemic, that we need to understand who we're serving, even including our staff, and continuity of operation, understanding the pain point, and human-centered design. I know that there was a lot of focus on human-centered design 10, 15 years back. Somehow we forget that as the innovation was moving at such a fast pace that we forget to stay focused on human-centered design. And the way innovation is coming at a very fast rate. And so I think one of the things that we will have challenges, and we need to figure out how to still stay focused on human-centered design. So there's a value to the user community, but I think from the policy and process perspective, that I think, as you all touched on, thinking ahead of time, thinking about how we can do the continuity of operations, how we're serving and addressing some of this. And I know, Michelle, you use the term EMO, or Enterprise Memorandum of Understanding, is something where we can think about our mission, our domain in which we are as an enterprise, and who our stakeholders are. So we are packaging everything together, how the data is stored, how the technology is brought in. And then I know there's a lot of discussion on the sharing around the data, because I know it's funny, that's part of the IJIS mission, but innovation is also forcing us to collect a lot of data. And I agree, Michelle, you touched on not having a data warehouse. And then I think the way, Benji, you talked about, and Denise, the way you talked about, was that having the data and data stewards, giving them the responsibility to say who you want to share with, when you want to share, and how effectively they want to secure it, because it needs to be passed on. Because sometimes what happens, we get so much focused on innovation and data sharing that we forget that once data leaves our four walls and it goes to our stakeholder, what policies and what security they're applying. Is it protected? And same thing goes, Benji, you touched on the solution providers. The technology industry also have to focus on compliance. It is not just the government agency's job to focus on compliance, but going back to the human-centered design, but I think it needs to be policy-centered design and having compliance as throughout the process of mapping the journey where the compliance comes in. So, so I know that we have a few more things that I will mention in a minute, but let's go to the questions first. So the first question is, we cannot predict the next thing that will need the same level of cross-agency data sharing. So how are you each working to make sure that the necessary data sharing will already be in place for events in the future? And then the second part of the question is, how do you ensure that a holistic system is put in place that is not over-focused on data that may help this event but may not be relevant to the next event? So any takers?
This is Benji. I'll take a stab at it. I'll answer it two ways. One way is selfishly from an NEC perspective. I'll share a little bit about what we do at the basic R&D level, which, I mean, we spend a ton of money annually on basic R&D for all of our technologies. And how that translates to the real world is keeping those technologies healthy, keeping them modern, keeping them updated so that they can meet whatever the mission criteria is and how it changes, right? So we try as much as we can and as much as possible to adapt and to foresee any changes that might come down the road. And so if, there's the next crisis or the next pandemic, how do we modify our technology so that we can meet as much of that as we can ahead of time? The second way is that participating in standards bodies and making sure that our technology is standards conformant, right? I think that's a critical thing. On the chat, I was kind of watching somebody else mentioning 5G. 5G is a tidal wave of change that we're going to see coming soon. And all of these new technologies that we used to call simply Internet of Things or virtual this, that, and the other, all of that stuff is going to have to be driven wirelessly by 5G networks. And so the question becomes, how do you ensure that, data it can flow freely? Can everybody have access? All those things. I was on a call yesterday about, talking about Open RAN and open networks, basically making them standards based, making them open for all vendors to bring new technologies and put them on the network so that it's not just one proprietary vendor or two. I mean, we see this all in the news all day long about Huawei, right? And the concerns about cyber protection and theft of data or whatever. I think that being able to be standards based, standards conformant, roll out networks and platforms that are open and standards based is critical. It's not only good for the government and their missions, but it's also good for the private sector for competition. And then second is keeping steady on R&D and trying to foresee as much as possible where things are going with technology.
Thanks, Benji.
Can I just add to that to say that I think that having an infrastructure in place that makes it an ongoing priority puts you in a position to be prepared to address the next challenge. I know that in my case, the county is invested in this new position and is investing in making sure that there's a framework in place that says we're not just going to pull resources together and wait for the next crisis, that we're focusing on what are the consistent, repeatable processes that we want to have in place to be able to do this on a regular basis. So that is critical. The other thing that I want to say that Denise touched on earlier is that focusing on what problem you're trying to solve is so critical as opposed to just sharing data for data's sake. So that is, you have to start off with saying, what is it that I'm trying to address or solve?
Thanks, Michelle. Ganesh, you were going to.
Yeah, the only thing I would add just real quickly in terms of preparing for the future is, everything everybody echo what everybody else said, but just making sure the data is easy to get access to. We've got an API strategy in place, right, along with our data stewards to make data really easy to access once there's like an authoritative reason to do it. And then the other thing that VA is doing is modernizing our analytics environment. We've done some great stuff in that space, but I think putting effort and resources into modernizing analytics space and having those large data lakes with data sources at the go and at the ready for any sort of like research and commingling of information that's going to be needed downstream.
Thanks, Denise. On this, along the lines of getting the data, focusing on data, getting a feedback, there's a question in a chat box is that, and I know, Michelle, you touched on this in the quality of data. So how can government share back the information to provide value to the frontline staff? Because as a government agency, we collect a lot of data, but also sometimes we we don't engage our staff who's actually out there in the front line serving. So the question is about how can we basically do a better job of providing the information and value to the frontline staff?
Can I take the first shot at that?
Sure.
Yeah. So I mentioned earlier about the quantitative data and doing surveys and getting the voice of the customer back into the operations. One of the things that we've done at VA is to collect data that's only actionable, right? So don't ask something that you're not going to take action on. But we've been using machine learning, natural language processing on the back end with that data and really deriving meaning out of it and pushing it out to the frontline staff. So whether it's pushing it out to a contact center to do additional outreach for maybe a veteran that's at need, or even things that come in on surveys where we recognize that a particular veteran might be at risk, for suicide, and pushing that out to the crisis line, to make that phone call. So we've done a loop, right? So listen to the customer, collect that data, apply analytics to it, be predictive, and then push that information out to the front line so they can either do outreach, service recovery, or take whatever actions necessary.
I would add the value of including the frontline staff in the process, which probably aligns with some of what Denise was saying about hearing from them, but involving them in the process so that they understand and have a role in clarifying what questions need to be answered and some of the challenges and barriers that they currently have, so that as we're thinking about solutions, we're really addressing where the issues are and not making an assumption. I think that is critical. The other thing that I would say is there has to be an ability that if we're collecting data from frontline staff, to share it back with them in some meaningful way. Let them know like how it was used, have that ongoing communication so that you can filter out steps in a process or data that wasn't used or wasn't incorporated into whatever process was done before, so that you can make it easier for them as well. You don't want to continue to collect data that isn't being used in some effective way. So make sure that there's that continuous communication as well, and saying, here's what we did with what you gave us.
Thanks, Michelle. So I know we're a few minutes over, but in wrapping this conversation, I'd like to give all of you one last opportunity to say if there's one thing from the innovation perspective, what that innovation will be going forward based on the lessons learned from this pandemic. So Michelle, we'll start with you.
One lesson. I think the lesson is about continuously trying to stay upstream and thinking about where future challenges will be. So being more thoughtful about that forecasting and predictive analytics. And while you can't predict a crisis, you can think about what functionality your staff can and will benefit from, as well as then your customers. And how can you make sure that you're aggressively pushing that agenda forward?
Denise?
Yeah, I would echo Michelle and just maybe add to it, like, invest in infrastructure today. I mentioned earlier that, in the VA, we made substantial investments in a number of things that enabled us to be really agile when the COVID pandemic happened. So I think those modernization initiatives you have, especially in the digital strategy space, I think our customers are, from a public sector perspective, our customers are expecting an experience on par with the private sector that they have every day. So, I think making sure that we, invest in, at least in that channel, and that the infrastructure is in place, the security is in place, and always, focus on solving the right problem and having access to the data.
Thanks, Denise. Benji?
I think from our perspective, we're seeing the promise of computer vision and artificial intelligence technologies finally coming to life, right? We've been talking about it for years and years and how cool it is and it's going to change the world. I think, it needed to prove itself, and it needed to have a moment to be deployed and be widely accepted and adopted. I see that happening now. It's going to take a while yet, but it's finally starting to accelerate. And I think it's going to have a real world impact. It's going to affect missions. It's going to affect people's life in a positive way and probably in some negative ways. But with any technology, you've got to figure out how to normalize it and how to get it to that mass adoption phase. And I see that plateau of adoption coming more rapidly now.
Thanks, Benji. And I think that was one of the points you all mentioned also, is the shortening that implementation and support broader adoption, because we don't have luxury of spending years and years and a lot of money to implement this technology. So that is one of the big lessons learned. So I'd like to thank all the panelists. This was a great discussion. I know we still have some questions, and we'll try our best to get them answered. And if we don't answer them in the chat box, we'll reach out to you and try to put the information. And I know there was a question that was asked if this session will be recorded and posted. So yes, it is being recorded, and it'll be posted on the IJIS website. So again, thank you, everyone. Stay safe, stay healthy, and take care of yourself.
Thank you.
Thank you.
Thank you.